Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Today I am talking with Madison, who's the mom of 2 living children and has also experienced 3 pregnancy losses. After learning that she carries a genetic condition that each of her children has a 50% chance of inheriting, Madison found herself navigating difficult decisions about how to grow her family. She talks about experience pursuing IVF, the complicated emotions of entering fertility treatment, and the heartbreak of additional losses along the way. She also opens up about her ectopic pregnancy journey, the frustration of not feeling heard by medical providers, and how she was ultimately diagnosed with endometriosis. Hello, everyone. Today I am here with Madison. Madison, do you mind telling us a little about yourself?
Yes, hi, my name is Madison. I am currently a mom of 2. Easton is 5 and Kai is 3. Unfortunately, I do have 3 losses under my belt as well, which I'll get into a little bit later. I live with my husband. We live here in Maryland, Harford County, and we're right on the East Coast. We're about 2 hours from Ocean City. And right now, I actually just graduated last week with my associates in social work. So I will be starting my bachelor's program actually in 2 weeks. um,
Congratulations.
Thank you, thank you. So that's really exciting. I was going to go into nursing, but advocacy for myself and my son just led me to a different path. So we will be starting that, and I'm really excited for that journey. But other than that, we're just living life chaotic. Yeah, that's about it.
Yeah, that's so exciting. I feel like, going through loss and things like that just really kind of changes I would say your path forward. Like the things you thought you might be doing are not the things that you end up doing.
Yeah, it really does. And if I learned anything from loss, it's the fact that, like, you know, I feel like a lot of people are like, go, go, go all the time. And, people are like, come on, kids, a little bit faster. And I'm like, the point maybe is to slow down. And I just live by, okay, let's all take a breather. We're going to slow down, live our life a little bit. So loss has definitely taught me to just take a pause. We're okay if we're late. We're totally fine.
Yeah, like it won't be the end of the world, right?
Exactly, yeah, they can wait.
So, do you mind talking a little more about your lost journey?
Yes, so my lost journey started in 2020, and it was my first pregnancy in April. We weren't trying at the time. We had just bought a house. Like, we had just moved in, we bought a house, and something yielded me to test, and I took a test, and I didn't know at the time how implantation worked, how anything worked, how, in my mind, I was just like, okay, you kinda do the deed and then you take a test, like, the next day. So I was so oblivious to absolutely everything. So, at the time I wasn't on any birth control and I took a test and, I watched it for a minute and as you know, it's all like you gotta wait for those full 5 minutes
Which
and
is really hard.
I just chucked it in the trash after a minute and I think it was still going at the time and I was like, whatever. So later on, I had ended up pulling it back out the trash and it had read positive. And I was like, no, 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 that, we weren't trying, but we weren't preventing. So I was like, okay, well, I'm going to take another one. So that time I read the directions, I waited, and it came back positive again. And I called my then fiance at the time and I was like, hey, the test is positive. And it was just like, I didn't know what to do. I didn't know who to call. Like, I was just like, what now? And I didn't even know how far along I was. I wasn't tracking. And I just started bleeding like I want to say 2 days later after my positive, and at first it was like brown bleeding, and then I was like, whatever, it's probably part of it. I don't know. That's when I called my doctor, and they were like, hey, well, we advise you to get checked out. So that's when I went to the hospital, and that was April of 2020, and they said that. Yes, your HCG is very low. I believe it was at around a 25, 26 at the time. And they told me to come back 48 hours later. At the time, I didn't know about how common miscarriages were or that I possibly could have been going through a loss at the time. I just was like, I'm still pregnant, I guess. I don't know. Until that brown bleeding turned to bright red period blood. So 48 hours later, I went back to the hospital and they let me know. They did an ultrasound, they did all the normal lab work, and they let me know that my HCG was under pregnancy level. I believe it was like a 3 or 4. So that's when they said, "Hey, you're having a miscarriage." And at the time, COVID had just hit. So he wasn't allowed in the room. I was by myself. Everybody's wearing masks around me. I'm hearing the nursery songs playing in the unit next to me. So I'm just like really lost at that time. And I'm just like, I don't even know what to do because, my boyfriend at the time is sitting in the parking lot waiting for me to come out. So I did what I could. I was 19 at the time, and like I said, we had a house, things were rolling in our life, and I just was like, why did this happen to me? I didn't understand. And that's when I realized how common losses are. And that's when I started joining all these trying to conceive for loss groups and talking to other women who are in my shoes at the same stage. It was like, okay, wow, like it's not just me because it did feel very lonely because I was like, why me? I don't understand. Is there something wrong with me? Maybe I can't get pregnant at all. So it was for my now husband and it was definitely a hard time because not only did I have to tell family that I had a miscarriage, but I also had to tell family that I was pregnant and I didn't know. So that was just kind of hard for everybody around. And we had the conversation of, okay, what now? We went to the doctor. They had the talk of, living the healthy lifestyle for both my now husband and what we can do, and how we can either, move forward or prevent pregnancy in the future, whatever we wanted to do. Ultimately, my husband and I decided to start trying, and we just we waited for the bleeding to stop, and I was learning a little bit more about pregnancy and tracking, the get pregnant fast with pre-mom and the LH test strips. And so I was buying LH strips. I didn't know how to use them, but I was just experiencing everything for the first time. So I just kind of went with it, and that's when I started. About 2 weeks after the bleeding stopped. The bleeding I was only lasted about 5 days, and I got a positive LH test. And that's when we had the talk of, okay, do we want to wait or do we not? So that's when we decided to, okay, let's go ahead and try. It was definitely a hard time because it felt like in my mind that I should be making more time to grieve this loss. But at the same time, it was like, I'm also ready to move forward as well. And it was just kind of like a battle of back and forth of, okay, like something's telling me like this is wrong to do, but this is what we also want at the same time. So we did end up trying, and we ended up getting pregnant with our rainbow baby, and he was delivered December 2020. He was healthy, 37 weeks. Vaginal birth, I did have preterm premature rupture of membranes, but thankfully I was able to keep him in until 37 weeks. And that happened right around 35 weeks. And they did the Pitocin at labor because I didn't even know that I had a slow leak. I had just gone in because I was like, I just don't feel right. So I went in, and that's when they started me on the Pitocin, and he was delivered healthy. So he's 5 now. So that was December of 2020. And about 2 years later, we decided to start trying for baby number 2. And we did this whole thing again of LH test strips, testing and tracking. I had a lot more, confidence in it, especially with doing it with my last pregnancy. I learned about, pregnancy test hook effects. Like I was like deep into research. Like I felt confident. I knew what I was doing. So we got pregnant again. And I think the second pregnancy was harder on me when buying pregnancy tests because it was like, I mean, I was testing, 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 testing. It got to the point where I was like, I'm going through boxes of like 60 test strips, just testing and testing and testing. For me, like in my mind, it was like a pattern, and I expected a pattern to happen. It was like, I was like, it's going to be a loss. It's going to be healthy, which was my oldest. And I was like, well, I'm going to expect another loss because it's just how it's going to go. It's going to be a pattern. I've fully expected it. And with both pregnancies, I was, going to the bathroom. I was checking, even if I didn't have to go to the bathroom, I was still checking to make sure there was no blood. So thankfully, everything was good with him. I did have hyperemesis gravidarum with my second. I did have a Zofran pump. Other than that, everything went okay until 34 weeks. I went into preterm labor again, where my membranes ruptured again. And they did not tell me why, but my kidney was actually being blocked off by my uterus, and it was shutting off my ureter on that side, so my kidney was swelling up. So I did have to have a nephrostomy tube placed to drain out the kidney. And I went into full-blown water break labor at 36 weeks. He was delivered via C-section, and he went straight to the NICU. He was having some temperature instability. He was there for 13 days. But it was just, even at, 20 plus, 30 plus weeks, I was like, as awful as it sounds, I'm like, I'm expecting this loss. And it's just like, you know, everybody around me was just like, stay positive, stay positive, stay positive. So I really, really relied, and to anybody, I always recommend like going on Pinterest and read the mantras, or read, pregnancy affirmations. So just getting those pregnancy affirmations and setting them as my screensaver for ones that are like, this is a different pregnancy, my body knows what to do. Just those helped significantly. I do wish that, I wasn't, testing at 7, 8, 9 DPO, I wish I wasn't on that, I feel like knowing more was hurtful in a sense, because it's like, when the normal person might find out they're pregnant is later on, and here I am knowing super duper early at 9 or 9, 10 DPO. Like, what am I gonna do? Am I gonna call the doctor and say, "Hey, I'm 9 DPO, it's positive today." So that just felt really off to do.
I was an early
And so
tester too, so I completely get it. Like the second I could, and then I'm like, why do I do this to myself? But I could never wait either. So
yeah, it's really hard not to. So, everything was, fine with him, so I'm blessed for that. And then in November of 2025, actually, we'll back it up. In May of 2025, we started going to a fertility clinic. And the reason is my youngest, the one that was in the NICU, he's 3 now, but he was diagnosed with a genetic condition called 15q13.3 microdeletion. We went through rounds of testing and to get to this conclusion, because there was a time where his peers were walking and talking and he wasn't. Thankfully, we were really close to Baltimore, which has your Hopkins, your Kennedy Kragers, the big hospitals. So we were able to get him diagnosed by the age of 1. And because of that, and because I'm a carrier for that condition, all my children have a 50% reoccurrence rate. So I could, whatever children in the future that I have a 50% chance of having it again. I'm just so thankful that the condition is treatable. We just work through therapies, that kind of condition. So when we started the IVF process, we got approved, my husband did the analysis. I did the baseline ultrasounds, and that's where they told me, they said, you only have one follicle. And that really took me back, because they told me as a 25-year-old, I should have way more than just one. And they said, even if we stimulate you, it's unfortunately just not going to be enough. But let's continue forward. And I took that really hard, because it's like, I have the kids. I have the 2 healthy kids. So where are my follicles? Where are my eggs that are supposed to be here? Like, you're telling me that 50% of my embryos are going to have this genetic condition, and we only have one? Like, I'm not going to go through IVF for us to get one, and 50% chance that it might not even make it to blastocyst stage. And then you have a 50% chance on top of that for, my own genetic condition. So it just like, it honestly just felt like the world was falling apart. And then I got a call from insurance, and insurance said because I did not have the infertility diagnosis, they were also withdrawing. They were going to cover 20%, and they decided they were going to withdraw completely. And so now I was left with a bill with no stimulant medications, no plans to continue IVF, and it was just kind of a, we can redo your baseline labs and ultrasound next month. And I
Like,
think
way
I
to
was
kick me when I'm down, you know?
I know. Yeah, and I explained to them, the insurance, I was like, I'm trying to explain to you that my other child has a genetic disorder, and we've been in therapies for 3 years now. So we can avoid that by doing genetic PGT testing. And they just were not budging. And I was like, wow, this really sucks. And in a sense, it also felt, and I understand that I was approved for IVF, and I have a right to be there, but sitting in a room, a waiting room of people struggling to get pregnant with the infertility diagnosis was really hard for me too. It just made me, uncomfortable, and I know that, like I said, I have the right to be there, but I just it was just really hard for me to do. So my husband and I, we had a conversation, and we were like, look at our son Kai. He's doing amazing. He's graduated so many different forms of therapy. If we do pull from IVF, because we're running out of funds at this point, is there a chance that, we would be okay with another kid with 15q 13.3? And I had a really hard time wanting to pull from IVF because it was like, in the back of my head, it was like, if you knew your future child would have a genetic disorder, would you? And it was just really hard for me, but I looked at him and I'm like, I know what to do. I know the early signs of a child with his genetic disorder. I know how to care for him. I have advocated so hard for him. I've spent so much money on genetic testing, weekly therapies. Like sometimes we were going 40 minutes away to therapies, and it was just like IVF was almost like it was just additional stressor that we didn't need. So ultimately, we did decide to pull from the IVF. We did let them know, and it was really hard for me because I'm an empath at heart, and I just was like, I'm so sad because I do have the opportunity to pull from things like this because I can get pregnant naturally. Not everyone can do that. So it just like, oh, it was like I was getting throat punched. I fell for these other women that, have a hard time getting pregnant. So, those were emotions I worked through. So we pulled in June, and then we waited 6 months while I was just like, it was just this constant battle of like fighting, like this doesn't feel right. But I know I also need to focus on what's best for my family too. So in September, I decided to get my IUD out. And that was an experience in itself. That was a pretty painful experience. My string had completely coiled up inside my uterus. Thankfully, after like 20, 30 minutes, they were able to get it out. And we were good to go to try to conceive. And my husband and we started trying right away. My husband and I got married October 17th of 2025, and I was in that, I think I was like 9 DPO for my wedding, and my tests were still positive. I was like, the LH tracking, I felt so confident with it. And I just was like my second came on, first when we started agreed to try, he came on very fast. And I was just like, it's negative, it's negative, it's negative. So I kicked it up as, just my IUD, my hormones regulating, and we gave it a break. And I realized within that time of getting my IUD out that my I knew my hormones. Like with my IUD, it was like, when is my period gonna come? Am I gonna get it? And what is happening? So once I got it out, it was like I was like in tune with my body. I stopped LH tracking because I was like, I know when I'm ovulating now. My body's telling me that I'm ovulating. And it got to the point where I was only taking like one test, and it would tell me, it would be like, blazing peak. And I'm like, I know my body. I just don't feel like I need to LH anymore. So I'm just so thankful it went to regular periods and I was able to not track. In November 19th, I found out that I was pregnant again super early, somehow, some way. I just, my symptoms were that my boobs hurt. And so I took a test. It came back positive. We had gone past that thought of, lost baby, lost baby. So I was like, okay, this will be a breeze. I, you know, I wouldn't expect to have another loss. So I was like, why? Why? So, about a week later, I started bleeding. I woke up just covered in blood. And I noticed that my tests, I was getting my HCG drawn and it was very low. Like my level was 14 when I first got it drawn. And I chalked it up, and my progesterone was around a 6. So, I had been supplemented with progesterone and I had hope and I wouldn't think that I would wake up bleeding. I was obsessed with the tracking again, the pregnancy testing again. And I'm like, why are they getting lighter? I don't understand why they're getting lighter. And it was like, I would hold them up to the light. I would look at the floor, I'd hold them at the window. And I'm like, why are they getting lighter? I don't understand why they're getting lighter. So, I was like, is it the hook effect? Is it too early? I'm not going to call my doctor to ask this silly question. And then within 48 hours of my tests almost coming to negative, that's when I woke up covered in blood. And I got my HCG drawn again, called my doctor, got it drawn again, and my HCG was at a 2. He told me I was no longer pregnant and I had just suffered a chemical pregnancy. So it kind of felt really unfair for me because it was like, okay, I have a miscarriage now. Now I've had a chemical. And it just felt like one after another. And I started tracking again with the LH. And within 2 days of the bleeding stopping, I noticed that I had a peak. And I should have had I'm not even going to say should have because nobody could have expected what would happen next. But I remember just taking it and being like, "What? I'm ovulating 2 days after I just stopped bleeding? That's a little odd. It's not my history, and I'm a very regular person." So, I took it as a sign. I talked with my husband and he was, completely on board. Gosh bless him. So, we were like, "Okay, the bleeding's over. I feel emotionally and physically okay. So, let's go ahead and try." And we started trying, and immediately I called the doctor as soon as I got that positive test, which was right around 10 DPO this time. And my doctor was like, Madison, it's okay, it's nothing to do. It has everything to do with, ovulation and and the egg traveling. So it has literally nothing to do with, it does not correlate with loss. And I was like, okay, if you say so. So I got my HCG drawn. Everything looked amazing in the beginning. Everything was doubling. My progesterone was a little low. I switched from oral progesterone to suppository progesterone. In my understanding that it was just kind of like a quicker way to the uterus, even though, whether you use the oral or the pills or the oil, it is all just, it's progesterone is progesterone. So, because I tried to advocate for the progesterone and oil, and he just was like, Madison, like, progesterone is progesterone. It's not going to stop you from having a miscarriage, but it will support the environment, is what I was told. So, everything was good. And I don't know what it was, but I just, my HCG was good. And I just like had this bad gut feeling. And I remember telling my husband, I was like, something is wrong, something is wrong, something is wrong. And he's like, well, how do you know something is wrong? And he was like, I was like, I just have a feeling. And he's like, you cannot go off of a feeling. And I was like, okay, I completely understand that. So, I mean, he would go to work and I would get on Reddit, or, I would text my friends about it. And I just, they told me the same thing. They were like, you know, it's good to listen to your gut, but there's no indicators that something is wrong. So I was like, okay, I was looking for the healthy Reddit stories of whatever, late DPO findings. I was actually at a point where I was screenshotting them and making an album on my phone to save them to go back to when those thoughts did come in of, okay, I'm having another loss. So I got my HCG drawn for the third time, and I I think my expectation was for it to just double, and I remember it got to the point where I would set my alarm at 4 AM when I would get my labs drawn 24 hours later after getting them drawn because I know that's when LabCorp would release it. That is, like, how obsessed I became with my HCG and making sure this baby was healthy. And of course, those feelings of something is wrong was still, going through my head. And I remember waking up, it was around like 5 AM. I woke up, I just checked it, my whole family is asleep, and my HCG dropped 30%. And I was like, it just hit me. Like it felt like a lightning bolt just hit me in my chest. I woke up, well, I got my husband at 5 o'clock in the morning on a weekend, and I was like, I'm having another miscarriage. Well, are you bleeding? No. Are you cramping? No. Okay, so we can't say it's a miscarriage. I'm like, but in my heart, I know that it's supposed to double or at least go up in some form, and mine didn't. Mine dropped. I remember sending a, it's like I'm alone at 5 o'clock in the morning on a weekend. Who am I going to call? I can't call my doctor. I can call the on call, but they don't know my history. So I just sent the portal message and sat there. And I actually received a call from my doctor on the weekend. And he called me, and because we had met before, because I explained to him, like, why does this keep happening to me? Why is this lost? And he was like, well, you know, let's get that HCG drawn. So that's when he said, well, it looks like you are having another miscarriage. Expect the bleeding to start shortly because it was dropping fast. And he's like, I'm going to actually put in for another HCG in 48 hours. So I went and got it drawn, and he calls me back. And he says, I don't know how this happened, but your HCG has gone up. And I was like, that doesn't sound right. You just told me I was having a miscarriage. Your staff called me and said, we're going to cancel your ultrasound because you're having a miscarriage. So where's the bleeding? Where's the cramping? I don't understand. What do you mean it's gone up? That doesn't make sense to me at all. And he said, I was like, could this be ectopic? And he said, at this time, I wouldn't be concerned for it because you're not in pain. And, normally with ectopic, it plateaus, it doesn't, drop that much. So I was like, okay, everybody around me told me to hold on to hope. My parents were like, have hope. Ectopic is really rare. And I was like, okay, you know what? I will continue to have hope. I mean, this pregnancy, I think I was only 5 or 6 weeks at this time, and I felt exhausted already just, from, pulling these affirmations, having this gut feeling, everybody shutting me down. My husband's like, stop worrying about it. And it got to the point where we had an argument or two because I was just so obsessed with the idea that something was wrong. And it felt like nobody was listening to me. And finally I was like, you know what? I'm gonna give it all because I I have to listen to my doctor, right? That's the only logical thing that makes sense. So I get my ECG drawn, and he tells me it goes up, and he said it went up by 60%. So it dropped 30% and then went up 60%. So I was like, wonderful news, I'll take it. We get another ECG drawn. On Christmas Day, I had I took my gut feeling and I went to the hospital. And you can imagine how I felt checking in, and they say, "What is wrong?" "I don't know, I have a gut feeling," is what I literally told them. And I will never forget how they looked at me. They were like, "Okay, okay." And in my notes, it says, she thinks she has a gut feeling of an ectopic pregnancy. And I went for ultrasound, and they came back and they said, unfortunately, you have a PUL, which is pregnancy of an unknown location. They said, we can't tell you it's ectopic, but we also can't tell you it's ectopic. Your HCG is reassuring. It is going back up. It's doubling. Everything looks good, labs wise, but we can't see anything because you're still so early. Your HCG is still pretty low. And I was like, okay, I understand. I was so frustrated because I had gone to the hospital on Christmas Day, leaving my kids at home, going to the hospital, and I left with no answers. I can't explain the feeling of leaving the hospital with no answers because in my mind, it's like, hospital's a miracle worker, they'll figure it out. And I left with nothing. And I called my doctor and was like, hey, so I actually went to the hospital. And he was like, we'll monitor you, So that was on Christmas Day. And I continued to get my labs drawn and it continued to go up and up and up. So I had a good feeling and I ended up booking an ultrasound because I just, it had a week had passed by and I'm like, I need something else. So I went and booked another ultrasound and I told myself, I was like, nothing will probably show up because, ultrasounds at the, like a preview place is a lot different than getting it, going to, LabCorp or somewhere, because technology is different. So we got there and they said, we're sorry, we don't see anything here. So I had paid $150 out of my pocket to have ultrasound pictures of a thickened endometrium in my uterus. And they were like, the signs of pregnancy are there, but there's nothing here. We don't know. And they checked my tubes and all, and obviously they're not diagnostic, but they were like, we can't find this pregnancy if there is one. At that point, it just felt like I gave up because I was like, there's nothing there. And I'm telling everybody my concerns, but it feels like nobody's listening to me. Nobody's taking me seriously. How many times I heard have hope, have hope, have hope was ridiculous. And finally, I just gave up and I was like, well, the only thing I can do right now is have hope. I felt like just there was nothing I could do. I remember, being at home and texting my husband, like, I think I have to be checked out in the morning. It wasn't that big of a deal, but I honestly think I was pushing off the pain because I knew my husband was going to be like, okay, you need to go to the hospital. So I told him, I was like, oh, it's not that bad. We'll just go in the morning. And it was just like, I think I didn't want answers. In my heart, I knew that it was ectopic. Just as soon as that pain hit, like within seconds, I was like, this is it. This is an ectopic pregnancy. I've never had one before, but I did so much research. Like I was saving the Reddit things. I read all the ectopic pregnancies. I read the chemicals. I even considered the fact that maybe I was pregnant with twins and I lost one. That's why the drop of HCG and it came back up. I was really trying every single alternative that I could. And as soon as the pain hit, I was like, it's ectopic. Finally something is happening. And as awful as it sounds, it was like, finally something is in my body telling me that something is wrong. And
Yeah, because
that's
you've had that
when,
feeling the whole time.
yes. And none of my other pregnancies gave me this much feeling that something was wrong. And, I was going back to, okay, something is just not right. So within 30 minutes, I was sitting on the floor. I couldn't stand, couldn't walk, couldn't talk. And that's when I was like, okay, like this is a medical emergency now. Whatever is going on in my body is not right. At this point, I've been pregnant 4 times and something is just very wrong. So that's when I texted my husband. I was like, okay, I need you to come take me right now, actually, not tomorrow. So I get to the hospital and I remember putting it into my notes of why I was checking in because I couldn't talk. I was in so much pain. And I just put in there, I'm having an ectopic pregnancy. And he was like, how do you know? Like, were you diagnosed? And I just shook my head. I was just like, no. So they took me back and thankfully they were able to give me some pain medication so I could tell them what was wrong and what had been happening. So they gave me the pain medication. I sat for 30 minutes. I was bumped to a priority 1 and they took me back, took my labs, my BP, everything like that. And I remember just sitting there with my husband. Thankfully he could be there. I just kept telling him, I'm like, I'm holding my side. I'm pushing my side as hard as I can because it's the only thing that'll help my pain. And I'm like, this is ectopic. And he's like, you don't know that. He's trying to be supportive. He really was. You don't know that. And I was like, but I do. I do know it's ectopic. Of course, I'm angry. I'm frustrated, even though I haven't been diagnosed with it. I'm just like, I've been telling you.
I've been telling you it's ectopic. I've been telling you something that's wrong. And in my mind in the moment, I just was like, even if you knew, there was nothing we could do at the time anyways. Even if you knew it was ectopic, it was way too early to know. So I get taken back and they do the ultrasound. It was so painful. And they did transvaginal and on top. And I just remember being in so much pain, gripping the sides of just this ultrasound being so painful. And I go back to the room. They came in and they said, hey, we need to do a pelvic exam. And I'm like, I'm full blown bleeding now. I'm in severe pain. I don't know what's wrong. And you want me to consent to a pelvic exam? And that's when they were like, you can totally deny it. I said, here's what we're going to do. You're going to tell me what's wrong with me first, and then I'll consent to the pelvic if I feel it's necessary. And they took me back and they said, your pregnancy is ectopic. And it should have felt like being hit with a ton of bricks. But I just have an internal feeling of like obviously I don't think the loss had just hit me. I was happy. I was happy that someone was finally listening to me. I was happy that finally I got this diagnosis. Like, it was just like, I'm just so over everything. And so I go back and I'm like, I'm calling my grandmother and I'm like, it's ectopic. And she's like, what? And everybody around me, like, all my friends are like, what? Like, we told, they're all the people that are telling me to have hope. And I'm just telling them, like, it's ectopic. And they're like, it's so rare. Everybody was like, it's so rare. Like, I don't understand. And I'm like, but it's not rare because it happened to me and it can happen to anybody else. And I think people just label ectopic as being a really rare pregnancy phenomenon, but I don't think people realize how common it actually is. I believe the statistic is 1 in 80. That's still up there. So I'm 1 out of 80 women in a room that had an ectopic pregnancy. There is a point where I cannot be without pain medication. I consent to the pelvic, and she is just like, something is going on. My cervix was actually tilted to the back of my body. I don't know if that was a sign. I don't know if that was from the progesterone or my uterus, whatever was going on. It just, when she did my pelvic, it was just did not feel right. And it wasn't painful. It was just like, it just didn't feel like my body. It was a very odd feeling. And the emotion still hadn't hit there yet because I was just like, I'm right. Yay. Finally, somebody's listening to me. So they start prepping me for the OR and they said, you haven't ruptured. Your HCG has completely plateaued from when you were here on Christmas, but I don't feel comfortable enough sending you home in this much pain. So we're going to take you to the ER to have your left fallopian tube removed and possibly your left ovary. And they bring in the consent form and the OBGYN. And I'm like, do I really have to have this surgery because I haven't ruptured yet? And she's like, I would have to talk to, my team and see what they think, but I don't feel comfortable enough sending you this home in this much pain. So she ends up calling my doctor and whoever else is on our team, and the resident OBGYN comes in and she's like, I'm okay with you going home if you promise me. She was so like, she was close to me. She's like, if you promise me, if you are in any pain, you come back. And I was like, okay, is this the right choice? My husband was there, he was holding my hand. And is this the right choice? And I just was like, well, obviously I don't want an organ taken out of me, so let's just move forward with the methotrexate. And a lot of people don't know that methotrexate is actually a chemotherapy drug. So, and it just like hit me because it's like, this really is a life-saving medication. I needed this medication to end a very wanted pregnancy. And it was just like, here's your medication. I'm sending you on my way. And I get to go home with nothing. And like, my pregnancy tests were still going to be positive. So I'll go home and take these pregnancy tests that are still positive because I have the HCG, and they're hoping with the methotrexate that my pregnancy is going to shrink and that my body would just absorb it. So thankfully, and I know a lot of women do have side effects with the methotrexate, I did not. I started to bleed and they want your HCG to decrease by at least 15% days following the methotrexate. My wonderful news, your HCG had dropped 60%. And it was just a very odd feeling because it was like, I'm celebrating this. I'm celebrating my HCG dropping when before with my losses and my miscarriages and everything, praying and hoping that my HCG doubles. So it was a very odd feeling of celebrating that my HCG is dropping, and it felt wrong. It really did. But I just kind of like sat with myself and sat in the moment. You know, this is an entirely different scenario. I try to be as patient as myself with I could. And I was just so happy that my HCG was dropping. And, you know, we were on the, you know, right path. And so my injection was on January 5th and January 10th. So I had my HCG drawn January 9th. So that's when they said everything looked good. January 10th, I walk in the door. It is bright and early, 7 a.m. in the morning. And I walk in the door and I just stop in my tracks. I just feel like I can't move my feet because if I do, I'm going to fall over. It hit me like a truck. It was just boom, you're in so much pain. And the pain was on my left-hand side, running over my left hip and into my back. And I just was like, we know it's ectopic. I got the treatment for it. So it's got to be constipation. You know, I try to use the bathroom, I try to lay down. And that's when I go to lay down in bed and I lay on my back and I realize I can't put my legs together. I physically cannot put my knees together without being in excruciating pain. So finally, I just, you know, my phone is next to me. I'm trying to, it truly felt like contractions. It was so painful. And finally, I just forced my legs closed. And all of a sudden, I just feel like instant relief. I'm going to take a nap because whatever that was, it's passed by. Seconds, I shoot back open and I'm like, something is wrong. I have another really bad gut feeling. And obviously, we know if I have a gut feeling to follow my gut feeling. And that's when I told my husband, I was like, something is wrong. I don't know if it's IBS constipation. I don't know if it's something at the time of my ectopic pregnancy. So I was like, maybe it's another kidney issue because I've had experience with the kidney issues. So we go to the hospital and I sit in the room. I feel fine. And I tell this doctor, I'm like, I was in pain. I'm not in pain anymore. I declined all Tylenol they offered me. And he said it's either constipation, diverticulitis. So I go for the CT, I go for the ultrasound, and I come back in the room. And all of a sudden, I see my doctor run past the nurse's room because I'm stationed right in front of the charge nurse room. I see him run past, stop the charge nurse room, and then come back in here. I remember looking at my phone, seeing the My Chart message that my results were in. And I told myself, I'm not going to look at them. And at this time, ectopic wasn't on my mind anymore because my labs were so good. And he comes in. He said, did you look? And I said, no, what's wrong? And at this time, I was like, looking up treatment for diverticulitis or, you know, what do they do? You know, am I going to need Miralax for my constipation? He just was like, it's your ectopic pregnancy. What do you mean my labs decreased 60%? It's shrinking. It's doing what it needs to do, right? And I just remember feeling so betrayed with my body because it was like, what do you mean? My labs were decreasing. Everything was fine. Like, I'm so ready for this horror story to be over. And I feel like it was trending that way. And he told me that it was likely that I would need emergency surgery. And I just remember being like, when will this end? And I texted my husband and I told him, I was like, okay, I think you actually need to come here because I'm bleeding and I need to have my fallopian tube removed. And it just felt so wrong because I'm currently 26 years old and I'm already having an organ, a very wanted pregnancy removed from my body. And that's when the doctor informed me that even if your labs decrease, and the one thing when I advocate for an ectopic pregnancy, the one thing I tell everybody is that you can still rupture. If your HCG is in above the pregnancy level, you can still rupture at any time. And they told me it would be a sharp pain. I would have shoulder pain with it. I would have severe back pain. But as I was telling you, mine just felt like gas pain slash constipation. So I'm so glad I went in. But I remember going into pre-op and being like, I don't understand. Like, can I just go home? I'm not in any pain. And that's when they were like, you're going to come back because you are bleeding. It's a slow bleed, but you are bleeding and it just started, but your pain will come. So that's when I was like, I guess, I just hit with emotions. Like, I can't even explain. It just didn't make sense to me because I'm sitting there in no pain and they're telling me my worst fear has come true. And I do go for the surgery. Thankfully, they were able to save my left ovary, but I do have my right fallopian tube. I just no longer have my left. I am still able to get pregnant and sustain a pregnancy. And the cool thing about having one fallopian tube is I can still ovulate on my left side. My body in the fallopian tube will actually reach over and pick up the egg for future pregnancies. With the ectopic pregnancy, my surgery was laparoscopic. So I have 3 incisions, one of which is in my belly button, which you can't even see. And I have one on my right hip and one on my left hip. And within 48 hours after my surgery, I was out of breath a lot because they have to push that gas into your abdomen for the laparoscopic. I remember being in severe gas pain under my rib. So the gas X helped. But other than that, it was so successful as it could be, given the circumstance. And they sent it off for pathology. And I don't think the ectopic pregnancy really honestly hit me until I got that pathology report back. It took about 4 or 5 days. And I remember getting a MyChart message that the pathology report back, and it had said, they received the sample size, what it was, placental tissue was present, blood present, and how this is an ectopic pregnancy. And then that's when it all just hit me. And I was like, wow, okay, this is an ectopic pregnancy. Now it's time to focus on my healing and myself and live in the moment with my kids. Because had I not listened to my body, then who knows what would have happened. So that was just really scary to think about. And as time goes on, it seemed to get harder and harder because it's just those thoughts of, because I've had an ectopic pregnancy, I have a 10% recurrence rate of that. So that's really heavy and really scary on me. And there's nothing I can do to prevent it except, my amazing providers and team, early, more beta HCG draws, an earlier ultrasound. But the risk will always be there, unfortunately. And it's just hard because I only have one fallopian tube left. Because I had withdrew from IVF, of course, those thoughts of, well, what if it happens again and I lose my other fallopian tube? I'm going to have to go back to IVF. That's my only option at this point. But again, affirmations, I'm trying to remind myself, we're not going to think about that. I have an amazing team and they do what they can. I've talked to them twice about how I'm feeling, and it was just a lot to take on. And like I said before, okay, at the time I had a miscarriage and then I had the chemical. Well, now I've had my 3rd loss, which is an ectopic. It's kind of like, what next? I've had, almost every early loss there is in the book. So it's just, and because the 2 back-to-back losses, I did go to the doctor and I was like, do you want to do a reoccurring loss panel? Like, what is next? And he took a look at the pictures from my surgery, from my ectopic pregnancy that the laparoscopic tool took. And that's when I was diagnosed with endometriosis. I had no idea I had endometriosis. My periods were always on time. My doctor did tell me that it could be silent endometriosis, things that I thought weren't symptoms could be symptoms, like, right before my period, I'm hit with severe pain, a lot of like IBS symptoms. I'm diagnosed with IBS, just small things like that. And I'm lucky I still have a normal period, but his suspicion was that the endometriosis lesions might have kinked the tube, and that's why the egg couldn't travel to my uterus. So that was a lot to take on as well. And I've tried to sustain a better eating habit in my lifestyle to, hopefully help with that. It's just, I'm just speechless still at my experience and what had happened. And I really like to advocate for people. And, I'm in these loss groups, and every time I see someone's like, oh, my HCG dropped and it's going back up, I always tell somebody, hey, if you're experiencing severe pain at any time, you should go get checked out. Non-medical advice things, but
Yeah.
my ectopic was so scary, and nobody it's like nobody believed me when I felt something was wrong. And like I said, my husband was supportive, but of course he's not going to be like, yeah, I feel like something's wrong. So I just wish somebody had believed me when I was telling them that, hey, I think this is ectopic. Hey, something is wrong.
And that's
Nobody.
hard because I feel like we know our bodies best and we get those feelings. And even if we can't prove, like we have no proof of that feeling, like we just know these things.
Yeah. Yeah. And the hardest part about it all is that, of course, I was pregnant with one of my friends, and she's able to go on with her pregnancy. And I tell myself is my grief and my happiness for her can coexist at the exact same time. I can be happy for her, but sad for me. And it took me a long time to come to terms with that. I will come to your baby shower, but I'm sorry that I cannot be 100% fully present there. I want to support you, but I also have to focus on myself as well and care for my mind, my mental health, and what I went through. So that's pretty much my story. And we have not started TTC back yet, solely for the purpose of, number one, I'm still processing everything. And it's just, I tell everybody it's kind of like waves. Like, it hits you one day, and then sometimes you're just coasting along, everything is fine. And then just something small, like even like looking down at my stomach, I'm like, oh, it kind of like puts me in the dumps, because it's like, oh yeah, that's there. And I'll always have a constant reminder. I'm so happy that my body alerted me something was wrong, and I'm just learning to take care of my body. But at the same time, it's just like a constant reminder of what I went through and what had happened. So yeah, and also because the methotrexate is a chemotherapy drug, you cannot get pregnant on it. It can be very dangerous for the fetus and the mother. So we had to sustain for pregnancy for several months, and we're cleared now. But like I said, am still going through the emotional toll of the ectopic pregnancy, and the idea of having two losses back to back has been really hard on me. My doctor doesn't feel like we should do additional testing. The hardest part of the ectopic pregnancy and resuming TTC is, yes, the ectopic pregnancy is a loss for me, and it was one of my hardest losses. But in the medical standpoint, it was wrong place, wrong time, and not like, okay, you're bleeding from a miscarriage, this is a pregnancy loss. It was just, hey, your egg didn't make it all the way to your uterus. So that would definitely hit me pretty hard as well. But yep. But my name is Madison, and that's my loss story.
Man, and it's just, it feels like you didn't even get one normal pregnancy because even with your living children, there was still, things you had to go through. So you didn't ever really get to enjoy just and I just put it in quotes, but like a
Yes,
normal pregnancy.
exactly. That's exactly how I felt. And, this third child that I don't have yet is so very wanted. And just as May is approaching, because I started IVF last May, it's like, yes, I've gotten somewhere, but in my mind, it's like, I feel like I haven't gotten anywhere. You know, I've had those two losses, and it's just like looking back, I would have never thought this would have happened ever. And it was just a lot to take on.
Well, I want to thank you so much for coming on and sharing your story with us today.
Of course, you know, and I am a huge advocate for, you know, my son who has medical complexities and, you know, my children and my losses and specifically my ectopic pregnancy. I'm more than happy to talk about it with anybody. I'm an open book and I just, you know, what I didn't know, I hope the next woman, gosh forbid, I wouldn't want anyone to ever go through this, but if there is concerns, you know, have an idea of those, you know, signs and symptoms, you know, the possible shoulder pain, the weird trending HCG, the right or left sided pain, like those are all symptoms that I wish I knew to look out for. And I would hope, you know, anybody is aware, like this can happen to anybody, even if, you know, you have everybody around you saying it won't happen. Unfortunately, the risk is always there.
Yeah, definitely an important reminder for people to
Yep.
listen to their bodies and to those gut feelings.
Absolutely, absolutely. That was the one thing when I made my post and I announced to my friends and family this had happened. I just put, I'm proud of me for listening to my body.
Thank you so much, Madison, for sharing your story with us. One thing that really stood out to me from this conversation was the importance of trusting yourself. Madison knew something wasn't right, even when she wasn't getting answers and when nobody was listening. And her story is a powerful reminder that our instincts and our gut feelings matter. I also appreciate her willingness to share the complicated emotions that can come with growing a family when there are just so many unknowns and many difficult decisions involved. These conversations aren't always easy to have, but they help others feel seen and understood. If this episode resonated with you, please consider sharing it with someone who may need it, or leave a quick review on Apple or Spotify. It really helps the podcast reach more families who are navigating infertility and loss. Thank you so much for tuning in, and remember, we are all in this together.